Hello. Hello, my friends. Welcome back to my investment channel, Learn Value Investment with Manan Shroff. Today, I'm going to show you the three companies uh, that are startups, and I have a very high hope for that. I have these companies in my portfolio from last 2 or 3 years. Um, but I keep looking at progress every quarter. And the industry, what they are belongs to and what they are doing, it's a game changer. So my background is a pharmacy background, medical background. So I understand these companies well, and I understand that potential if they become successful. So I just want to share you my thoughts on these three companies. We will go by one company. We're not going to look at the numbers. We're going to look complete. We're just going to focus on what they are doing and how it is the game changer if they become successful. And we want to take advantage of it. In most cases, like this type of company, I don't exceed 2% of my portfolio. So if my portfolio is $10,000 or $100,000, I will rather keep my investment $2,000 in one company, and then as the story develops, I will keep adding more. But with that said, this is a disclaimer, and I just want to start with the first company, Oramed, which I am thinking is I'm regarding it's very highly important company. There were a couple of reasons for that. It's been over now 50 years, 60 years. Nobody has yet able to make insulin in the oral capsule form. There are companies that tried that. The Pfizer did with the inhalation, but it did not successful. This company is right now in a phase 3 trial. So in the medical terms, I mean, in the pharmacy background, if I say phase 3 trial means there are high chances of getting success because FDA won't allow you to move from phase 1 to phase 2 or phase 2 to phase 3, which is the final stage of approval. If they don't see any, if you don't present them with the good result, basically you have to prove them that the drug is working, drug is safe, drug is not toxic. So once you reach up to the phase 3 trial, that means their product, you have to give them importance. You have to look at them. They might fail on phase 3 trial, but I am reading a lot of stuff about this company, and I have some friends who are physicians, and they attend the seminars, and they were also very impressed with the result this company is getting for oral insulin. Now, what happens if we have the oral insulin? So basically, people who are using that, people who has a diabetes, if it's a type 1 diabetes, you have to take insulin in injection form, and you have to take 3 times or 2 times per day injection subcutaneously. What this company has the patented technology did is that they generate the same amount of absorption of insulin in the blood using the oral capsule compared to the injection. And if this gets successful, I'm telling you that it's going to be big market. It's going to be whole world, because even if you reduce your injections frequency from 3 times to 1 time, it's still worth it, because injection associated with a lot of side effect and inconvenience. You just, for capsule, you just swallow, it's done. So I have a very high regard. So I have put like about 2%, 3% of my portfolio in this company, and I'm adding it. Now, this company is also working on the oral COVID vaccine under the different subsidiary, which is called OraVax. I don't know how much importance that COVID vaccine now, but one thing we have to look also, that if this company is able to make insulin in the capsule form, they pretty much open for large area of parenteral medication that require injections, especially if they are chronic use injections, to convert into the oral capsule form or any other oral form by using their patented technology. So, I mean, if they get successful, the sky is limit. I mean, there would be tremendous things. It's convenient wise to the patients also, and the company can, I cannot imagine it. It would be within 10 years, it would be very huge, large company, or some big companies will be interested to buy out. So it's called the Oramed Pharmaceuticals. That symbol is ORMP. We're not going to see the numbers because there is no meaning of the number. But the high was $31. The low was $3.59. I've been adding it. But if you go to the company's website, and let's see the presentation. Okay. Let's see. I can download the PDF presentation. Okay. So here is the thing. See, they are working on this oral insulin, which they are expecting phase 3 data in the first quarter of 2023, means in the January. They just released the OraVax phase 1 cohort B data, which you can see it here. Oramed Pharmaceutical oral COVID-19 vaccine candidate shows safety immunogenicity in early study. So with that, they meet the primary preliminary phase 1 trial point, and they were able to generate significant antibody response as by multiple makers of immune response to VLP vaccine antigen observed in most patient dosed. So, if they convert, if they come up with the oral vaccine, that's also very good, because, but if we go back to here, excuse me, let's see. Okay. Sorry, my throat is not working. Okay, so here is their proprietary technology for oral drug delivery. They come up with this one, and it's pretty much, it's very, very, I was very impressed with their data and stuff. So if you look here, when they say oral insulin for diabetes, they almost in phase 3 trial. They wouldn't go to the phase 3 trial because each trial requires a lot of expense. I mean, they wouldn't go to the phase 3 trial if there are not high chance to make the product successful. They are also working on NASH, and they are in the phase 2, and then they are also working in oral GLP-1. So what is the significance? As I said, millions of diabetics inject insulin today and wish for oral dosage. And you can see here that in 2021, diabetes expenditure reached up to 966 billions. In 2045, you can see every 5 seconds, one adult die from diabetes. And so 1 in 10 adults on the planet have a diabetes. I mean, I cannot believe, I mean, if they come up with this. So here they were showing that injectable insulin, the oral insulin, the same amount of absorption is achievable using their patented technology compared to subcutaneous intramuscular injections of parenteral products. So as I said, that oral insulin has a significant advantage. Easy of administration is the main thing. You know, people, even though these two are there, I think easy of administration and balanced blood glucose control is more than to knock out. I mean, to give them a good head start. So I regard this company is very much, I keep adding money every quarter. If they release the new data, you can, and if you are from the medical field, you can always look the presentation on their website. I mean, oral insulin reduces exogenous insulin requirement. All this data are here. They have completed phase 2 trial with good. FDA is also looking into it because FDA is pretty much interesting if they can come up with the oral insulin. So this is the first the company which I regard the most. It's available right now for $6, and I think I'm just saying that if it gets successful, it will make lots of money. So with that, ORMP, we will move down to the another company, which is also in the diabetes group. It is called Sensonic. I have this Sensonic share from last 3 years. I'm a little bit disappointed with the management because this company has it's a wonderful product, but the execution is not yet done properly. And I will show you that what this company does. So what this company does is they're making the continuous blood glucose monitor. What does mean if you are not from, if you don't suffer from diabetes, or if you are not from medical field? So nowadays the company come up with the continuous glucose monitor, which you put it on your hand or on your belly. What that it constantly keep reading your blood glucose level. And there are few companies. There is one is a Dexcom, another one is Abbott Laboratory, Freelife, or I don't know what's the name. But all these companies has some disadvantage. The Dexcom, you need to change the sensor every 14 days. And also the disadvantage with the accuracy. Ever since accuracy is remarkable, and the reason why it's remarkable is because they put the sensor underneath your skin. So there are two advantages. If you see here, this is the like a small capsule-like structure. This is a sensor that you have to put underneath your arm. And on top of that, you put this sensor that transmit the data to your phone or to your Apple Watch or your glucose thing. Now, right now, they have 180 days. So once you put this sensor in, for 180 days, you don't need any other supply. And that is different from Dexcom and other companies. They are out that every 14 days, you have to keep changing the supplies, and it costs a lot. So they have very good, I have seen their patients information also. Let me see if I can find the patients. I think you can see this small video here, and let's see what this, what does it say?
This is going to make a difference, but I really had no idea just how big that difference was. Diabetes, I've gotten used to having to slow down my life to manage it. I tried Eversense because the sensor's under the skin, which means it isn't impacted by my lifestyle, and I don't constantly have to worry about babysitting the CGM. It gives me the freedom to live the life I want.
I first heard about the Eversense technology on a visit with a new endocrinologist. With other CGMs, I always had insertions that were not really comfortable, issues, things being pulled off, and sometimes I did not have accurate readings when I really needed them. When my physician told me that the Eversense sensor was completely inserted under the skin and I could have it long-term, I immediately wanted to try it. I just placed the transmitter over the sensor, hold it in place with a comfortable adhesive, and I can change it daily. What I noticed immediately after getting the Eversense was how much more comfortable and at ease I felt. I didn't worry about irritation from the adhesives or things being pulled off of me. It wasn't just the physical relief, but I also have now peace of mind because now I had constant data and information that I felt I could rely on to know where my blood sugars were at any times.
The removable transmitter is a game changer. I love that it's water resistant, so when I'm swimming laps or working out, it still works. But I also have the flexibility to take it off. After a little break, I can easily stick it back on without needing to have a new sensor insert. Now I feel confident. I can focus on my workouts, spending time with my family without wondering what my glucose levels are going to be.
What I love about the Eversense is now I know what is going on all the time. I get on-body vibration alerts when my levels are heading low or high, so I can actually fix those levels before it's too late. It's great because they're discreet and also add an extra level of safety that I always needed.
Eversense gives me the freedom to wake up and take on my day the way I'm not bogged down by fear or the unexpected or having to stop and replace anything.
I definitely feel more free and more in control. I'm able to more confidently run my own business, and my A1C is significantly down since switching. It's like just when I thought it couldn't get any better, it absolutely did. I would say to someone interested in Eversense to go for it. You will finally get the flexibility you never thought you could have. Eversense has been completely life-changing for me.
It's made a difference not just for me, but for my family too. I never want my diabetes to slow me down, keep me from being present with my family. And now I don't have to worry about it.
So as you heard, even I heard from the real life people, they were very happy with the product. The only problem right now, what I see with the management is not doing enough advertisement for this great product. I'm keeping finger crossed, and someday people will realize this is the very good continuous blood glucose monitoring system. Because if you look for, let's say, Dexcom, they used to be $400 stock. So $164, they just announced a split. So just think about the Dexcom, it's only the company is only providing you the same thing. It is providing you the continuous blood glucose monitor. If you see here, there are some disadvantages with Dexcom is that you have to change the sensor very often. You have to purchase, probably they have changed now, but before you have to purchase their monitor in order to monitor glucose level. But that being said, that if the Dexcom can trade at this high price, $102, let's see when did it started to do the big difference. So it used to be on October 5th, okay, in 2015, it was trading around, so, and then he started to jump as the more and more revenue pours in. So this is the second company I really like, which is called Sense, because with the Sense, I'm thinking they have the better product than any other continuous glucose monitor in the market. You can also YouTube and search reviews about Sense, Eversense, and you will find the real life patients, and you will find the non-biased review. And so I have a very high hope for these company also. The third one is also from the medical field after Sense is a ViewRay. And I'm thinking this is also very good game changer technology they have. So if you are not from the medical field, the cancer patient usually have to go through the radiation. And many times what happened that, let's say you have a cancer of prostate, or if you have a cancer of, let's say, colon, and the radiation not even damage the other muscles, other tissues like prostate and testicles and everything. Because what happened that so far there is no technology that pinpoint radiation on the tumor itself, but this company does, and it is getting traction. I can see that every quarter, many more and more patients are going through the system. There are only 54 installed systems, but you can also look for here. I will show you that why it is different. Let's see if I can find here. Okay, I don't see any here. Hold on. I will show you. They have the video, very good video about. Okay, for patient device, Meridian. Let's go to YouTube. MRI. Okay, so this is an overview of, I think this will give you very good idea. Let's watch.
The MRI-guided radiotherapy system from ViewRay is vividly different. Our breakthrough technology incorporates a unique combination of MRI and radiotherapy for simultaneous imaging and treatment. A continuous stream of complicated images delivered at sub-second speed allows physicians to see the entire treatment field during radiation therapy. Real-time imaging of both the target and surrounding organs means the physician knows precisely where the dose is being delivered as it's being delivered. Adaptive motion compensation software enables the system to target movement patterns during treatment. The ViewRay system incorporates imaging, dose prediction, and re-optimization into a single 15-minute period. Daily positioning images are automatically registered to the original treatment plan, with auto-concurrent targets and structure. On-table dose computation rapidly reduces dose distribution in the VBA field to predict the anticipated dose delivery. If the anticipated dose is unsatisfactory, the treatment plan is re-optimized using the most recently acquired patient positioning images. With the VBA system, the dose prediction and re-optimization is performed in the minutes. Once treatment begins, the MRI catches a continuous stream of soft figure images every 250 milliseconds in a single plane and every 500 milliseconds for 3 planes. Physicians can set acceptable limits on both distance and time for the gating parameters. Every time a sub-second image is captured, the system matches the image contour, checks the limit set by the physician, and determines whether to continue or pause the treatment beam. The tracking of the target and critical structure position, as well as delivery parameters, is continuous during treatment. On the VBA system, physicians have access to moving and treatment sequences, dose tracking tools to review estimated 3D dosing of different VBA cases, and position tracking tools that place virtual markers within the treatment image planes. With complete information and a range of powerful review and assessment tools, physicians can deliver targeted, personalized radiotherapy for each patient. High contrast scientific imaging, and the reduce predicting reoptimization. Continuous MRI-guided targeting. Breakthrough technology that is accurate, adaptive, and visibly different. The world's first MRI-guided radiotherapy system. Only from VBA.
If you, so I have also very high regard about this company. If you go to their website, and if you see the patient stories, there are pancreatic patients. I don't know how long this video is, but it's a 2, yeah, let's see.
And then they told me that after doing a CAT scan, they saw one of my pancreas. And thank God the doctor told me, I think you need to be admitted. So I stayed there. There was a Friday. By Monday, I got my biopsy done. And the day I was discharged, it was the 11th. They told me, you have pancreatic cancer. You need to see a specialist immediately.
So when I first met Daniela, she had just completed many months of chemotherapy after being diagnosed with pancreas cancer. And then at our multidisciplinary tour board, recommendation to continue. It's at that point. We treated Daniela as the first patient in the world receiving itself significant. It's just really been a tremendous accomplishment, not just for our team, also.
Yeah, but
That my radiation was going to be 5 days because I heard that radiations are 15, 20, 25. After radiation, I felt great, no side effects, nothing. Now my life like any other thing.
What makes the MR guided radiation therapy system and the MR Linac here at Miami Cancer Institute special is that it enables MR imaging during the radiation delivery. What this allows is for us to actually see the tumor during radiation, for us to automatically turn on and off the radiation when the tumor is in the correct location. And this equals greater benefit to patients, more survival benefit, and greater outcomes.
Oh my God, Miami Cancer Institute is the best thing ever happened to me. And they are like so professional, from the person that greets you, from the person take your temperature, like everybody, the doctors, the nurse practitioner, like you name it. I think this is the best place to come for cancer.
Yeah, so this company also, I am very much investing in this company is right now trading at $4. Their medical device is definitely game changing, especially for the cancer treatment, because what happened, I have heard the patient stories that people travel 3 hours to go to the hospital which have their system, because it produces very less side effect and it does not damage your surrounding tissue and muscles. So this is also, I have a very high hope for this. We will look, I will keep you posted as their progress. Today is what, October 9, 2022. We will do another review within 1 year. We'll see where these 3 companies are. So with that, I just want to conclude my presentations. If you really like the video, please subscribe. I'm going to, there is a subscription button on a video. So like, if you go to YouTube and let's say, in that way, what happened that you always have the latest information, and what you can do is basically you can subscribe here. Let's say, what is it? Because I'm not logging or what. I don't see why I don't see subscribe button. I think it is because I am already logged in. But if you go to any YouTube video and you see there is a subscribe button like this, if you subscribe, then anytime if I put the new video, you will automatically receive the new videos. And also it motivates me to make more videos if I have a more subscriber. So with that, I will conclude this presentation. If you have any question, we have a group, WhatsApp group, you can ask me. But I just want to get you familiar with these 3 new companies. One thing for the sure that you have to be very patient with investment. This is not going to be turn on like in the one night, the millionaire kind of things. I have invested in these companies from last 2 or 3 years. I'm monitoring their progress, looking for if their quarterly earning comes good, I put more money like that. And that's why I just want to show these, because we also want to invest in the companies. They are startup, and if it's in your knowledge field, and if you think it's a game changer, we should start putting money into that, not a lot of money, and then put monies according to their story progress. So with that, goodbye. Have a nice day. Have a nice weekend. Thank you. Thank you for watching video. Bye.